Friends, welcome to youtube.com oblique drvet channel. I am Dr. P.R. Patel, Professor and Head, Veterinary Medicine. We have already seen the gastrointestinal campylobacteriosis part 1. Here we will see gastrointestinal campylobacteriosis part 2. It is an important bacterial disease. In this part, we will study clinical signs, necropsy finding, diagnosis, and treatment aspect of gastrointestinal campylobacteriosis. First, we will see here the clinical signs of gastrointestinal campylobacteriosis. The most common clinical sign is diarrhea, and it is occurring most severe in young animals. Diarrhea occurring in most severe animals that suggest gastrointestinal campylobacteriosis. We have seen that common clinical sign is diarrhea and in young animals. Now we'll see clinical signs in dogs. Diarrhea is a common symptom. Diarrhea is either a continuous or intermittent. If it is continuous, it may cause a serious problem. The feces is watery, contain much mucus, and shows a yellowish green bile streak in the feces. Feces may be with or without blood. Duration of diarrhea is generally 3 to 7 days, but in some cases or few cases it may last for 15 days. There is decreased appetite, occasional vomiting, and a fever in few cases. Clinical signs of gastrointestinal campylobacteriosis in cows. Common symptom is diarrhea. Either diarrhea is mild to moderate, not very much severe. The feces may be thick but fluidy, contain more mucus, and contain occasional blood flakes. This suggests damage to the intestine. Now we describe the clinical signs in poultry. Most common type of infection is Campylobacter jejuni. This organism invades the intestine of poultry. The droppings of the poultry become fluidy, watery, and these droppings soil the vent and feathers of the poultry that provide the diagnosis of diarrhea. Presence of few blood spots in the droppings in more severe cases. Because of the diarrhea, there is dehydration, the poultry get depression, and finally death of the birds. The campylobacteriosis, especially gastrointestinal form, has a zoonotic importance. It causes disease in human being also. Similar diarrhea. In India, the Campylobacter fetus subspecies jejuni is isolated from the healthy population. and it is popularly known as traveler's diarrhea in human beings because it is generally found due to the travel. It is a digestive tract disorder and commonly causes frequently passage of loose stools 3 to 4 times a day. Along with passage of stools, there are abdominal cramps also. The disease is generally caused by eating contaminated food and drinking contaminated water during traveling by the campylobacter. So this disease has got the zoonotic importance in human beings. Here we will discuss necropsy finding of gastrointestinal campylobacteriosis. Chicken's 3-day-old shows severe affection of jejunum and ileum. In dog, there is congestion and edema of the colon. Mostly young animals are affected. In cows, there is involvement of jejunum, ileum, colon, and there is mild to severe hemorrhagic enteritis. The blood is present into the feces. There is edema of the mesenteric lymph nodes in cows is also observed. Here we will discuss diagnosis of gastrointestinal campylobacteriosis. The common symptom observed is diarrhea. So history of diarrhea and abnormality in the feces. The standard method for diagnosis is microaerobic culture of the feces because these organisms are microaerobic. Examination of fecal sample under dark field or phase contrast microscopy of fresh feces shows a darting motility of campylobacter. Very easy to diagnose this in the fresh species because campylobacter possess a polar single flagellum and it gives the motility to the organism. Many serological tests also detect the antibodies. Here we discuss the treatment aspect of gastrointestinal campylobacteriosis. The specific treatment is antibiotic, specific antibiotic. It is better if isolation of organism and sensitivity test is done before the treatment. The macrolide antibiotics such as erythromycin, clarithromycin or azithromycin orally are the most effective drugs for the campylobacter jejuni. Common fluoroquinolone antibiotics, ciprofloxacin, levofloxacin, gatifloxacin or moxifloxacin are also highly effective. Many drug resistance to the antibiotic is also observed. So along with a specific treatment for early and better recovery without complication, it is better to correct dehydration, electrolyte imbalance and acid imbalance. So it is better to infuse intravenous fluids to animal for early and better recovery. Friends, here I have discussed gastrointestinal campylobacteriosis. In that we have discussed clinical signs in various animals. necropsy finding, diagnosis and treatment aspect. Requested to share this information to veterinary and veterinary students. To promote the channel, requested to subscribe the channel. Thank you very much for observing this video. With this, we are concluding gastrointestinal campylobacteriosis. Thanks.